Aging. There are certain things that happen throughout aging. They start as soon as we're born, and we start aging from that point on. That's essentially what my notes say here. They say that we don't really see the effects of what we're doing to our bodies until we get older. So when we tell our children to eat their veggies or eat their food, we tell our adolescents, we tell our young or our young no. The young then, as they get older, take chances. They're doing themselves a disservice, because as they grow older, all those things that they did way back here that aren't affecting them at this time are going to affect them later on. One of those is going to be that we're going to get a buildup of lipids in our body, and that comes from the foods that we eat. And that's going to be atherosclerosis. Does anyone, okay, what's the question? Atherosclerosis. Atherosclerosis, the name, that definition, means buildup of lipids or cholesterol within the blood vessels. And usually we're concerned about them because they build up in the arteries. And where they talk about that is on page probably they start talking about some of it on laboratory tests in 311, but because I know that they're going to talk about it later on in the areas of what we're learning, you need to know it now for diagnostic tests. This is where lipids are deposited on the walls of arteries. If we have lipids being deposited along our arteries, and we learned yesterday, what do our arteries have? Smooth. And they're supposed to be smooth because you don't want what collecting there? Clots. So if we have a jagged and they're not round and smooth, when we've got these deposits of cholesterol, it narrows the ability of blood flowing. Eventually, what this is going to do is, because the artery, as we have learned yesterday, has 3 different layers, and you needed to know what those layers were, you've got it in my notes, that this artery is supposed to dilate and constrict in order to maintain blood pressure. If we have deposits along here and it's restricting the blood flow, we are not in homeostasis. Eventually, these plaques are going to collect more thrombin, platelets, red blood cells, get bigger, cause more, or cause an increase in the, or a decrease in the diameter of the artery, or a piece is going to come off and travel, or if it stays there long enough, this portion of the artery becomes dysfunctional. It is no longer able to dilate and constrict. And that's where we get into it hardening, not being able to open or constrict, and then that's called atherosclerosis. So atherosclerosis can come from repeated increased blood pressure on these arteries, destroying the ability for them to dilate and to constrict, or it can be due to the buildup of cholesterol impeding the ability of it to now dilate and constrict. So we're going to have problems trying to control their blood pressure either way. Do you get that concept? Okay. And that's what it says in here, decreasing the blood flow, the rough edges, they get clots. Arteriosclerosis, it's a deterioration of the walls of the artery, and this is usually due to an increase in pressure. And you can see that there's going to be an increase in pressure here, just trying to get the blood to get past these buildup of cholesterol. And if we're talking about the heart, with the coronary arteries here, any type of occlusion is going to cause then, what was that word? A lack thereof, a decrease in oxygen. What is that word? Ischemia. Get used to the medical terminologies because they're going to use it in your questions. So ischemia down here, where eventually it's just going to take a little bit to occlude it, then there's no oxygen, then there's MI. With age, our heart becomes less efficient. It doesn't pump as well. Cardiac output is going to diminish as the heart's not able to keep up with just even how many mLs each time? 60 to 80. If the heart can't keep up with that, and that's the normal over time, then we're going to have heart failure, and we'll talk about that later. So there's going to be decreased cardiac output and decreased heart rate. That is not a decrease in resting heart rate. Remember I said yesterday in our elderly, we're supposed to keep a heart rate, or should have a resting heart rate just like the young, of 80, 60 to 80. But on exertion, walking, you may keep a 70, and I'm going to go bounding way up to 90 or 100 or more. Do you get what I'm talking about with that?
Yes.
So don't get it confused, please. Okay. Oh, and it says there, resting levels are going to remain the same as our younger adults. Okay, with the page numbers here, you will not find this stuff in your book. This came from somewhere else, and it was a book that we used to use. Okay, so I just keep it the same, but you can't find that on page 234. I think you're into, what are you into there? GI? Yeah, all right. Medical history. When you first get any type of patient in, you are ascertaining a medical history. You are trying to judge, are we dealing with a past medical history, or are we dealing with a problem right now? So what we need to find out is, what is their medications? That's why medications are so important that you know. Medications tell you medical history because certain medicines, or all medicines, are usually given for one certain type of disease process. Although, as you probably have already been aware of, in term 1 and term 2, some of those drugs that we give also work for other problems in the body, such as the elderly get a little bit older, we get nerve pain. Nerve pain is a chronic type pain. Anyone remember what we gave for that?
Antidepressant?
Well, you could. That's for fatigue syndrome. You could have given Elavil for that. What about your anticonvulsants? Like Neurontin? Neurontin. Are you familiar with Neurontin? I believe a lot of your patients are on Neurontin now, but do they have seizures? No. They have chronic nerve pain, so we're giving it for the chronic nerve pain because it has that property of diminishing nerve activity. That's why we give it, and it's classified as an anticonvulsant. But that's why we give it for nerve pain, because an anticonvulsant or a convulsion or a seizure is a nervous irritability of the nervous system, and it causes certain signs and symptoms, and we don't want them to have those. Okay, you ask about the previous conditions, one of them being scarlet fever. Why do you think scarlet fever? What did we talk about yesterday? What do you think? Even though you've never heard of scarlet fever, but I did mention that scarlet fever, or I didn't mention scarlet fever, but I did mention about a certain bacteria that could cause heart disease later on in life or glomerulonephritis. Does anyone remember what that was?
Rheumatic fever.
Rheumatic fever. Okay, what was that usually caused by? Strep. So if you know strep, and now all of a sudden I'm saying scarlet fever, then you know that scarlet fever must be a strep origin. And it is. It's strep throat with a rash. That's what scarlet fever is. We get more into it, more children get it than what we do as adults. But it is that strep factor, because right underneath there, I believe I have rheumatic fever. And we talked about it yesterday, that rheumatic fever had a close connection to having a strep infection and then a couple of weeks down the road getting rheumatic fever, which then injured usually something within the heart, and usually what was that? Anyone remember? The mitral valve? The mitral valve, remember? Okay. Pardon?
Are you talking about the heart murmur?
And the heart murmur is the sign and symptom of that valve being injured way back when you had rheumatic fever. Is it putting it all together as to the story of how we got there? All right. Yeah, the starting was the strep throat way back when you were 5 years of age. And now all of a sudden you're 65 and you're having problems with your mitral valve. Okay, so that's why you get a history of past diseases, especially childhood diseases. Because what did I start off with when I started this lecture? I said what happens to us at being young is going to affect us way down the road when we're older, yes.
May I open up the back door?
It's really hot here.
You know what? I'm going to send you for a break, and let me go downstairs and see if we can get into the other, because I'm having a hard time myself.